Is it widely known that the practice of masturbation can have an often overlooked impact on men's health as they reach a certain age? Before drawing hasty conclusions, it's important to emphasize that this information is not intended to be alarmist. The goal of this material is neither to condemn nor to criticize. Instead, it focuses on a topic many older men encounter but rarely discuss openly. This silence often leads to misunderstanding, physical discomfort, and even long-term health problems. If you are between 60 and 85 years old and have ever wondered, how safe is this for me now? Or why have the sensations changed? Then this information is for you. As a urologist with many years of experience notes, his extensive practice shows that common mistakes made during self-sexual activity can, over time, lead to significant health issues. These include urinary problems, chronic pelvic pain, and even emotional disturbances often not linked to this practice. The truth is, habits considered normal at 30 are not always so at 70. The body undergoes changes, hormonal balances shift, and neglecting these metamorphoses can lead to subtle but serious consequences. Below, we will analyze 5 specific aspects that older men are advised to avoid during masturbation. These recommendations are not arbitrary assumptions or internet speculation. Each is based on deep medical expertise, numerous patient stories, and a current understanding of the health specifics of aging men. If your goal is to maintain a safe, intimate life, preserve prostate health, and boost self-confidence, these few minutes of reading might be the most valuable of your day. Let's begin. The first common mistake: holding urine before or during the act. One of the most underestimated, yet potentially dangerous habits among older men, is neglecting to empty the bladder before self-gratification. Many might mistakenly believe this action is harmless, or tell themselves, "I'll do it later." However, what seems like a minor delay can lead to serious negative consequences, especially for those over 60. The reason lies in physiological changes. With age, the bladder loses its elasticity, the prostate tends to enlarge, and the urinary tract no longer empties as efficiently or completely as before. This means any pressure arising during sexual arousal, particularly if directed at the pelvic area, can cause urine backflow, retention in the urethra, or involuntary leakage at the most inconvenient moment. Some men also experience post-void dribbling, which causes discomfort, embarrassment, and importantly, is entirely preventable. From a medical perspective, such a practice significantly increases the risk of urinary tract infections. When residual urine remains in the tract for too long, especially under increased pressure, it becomes an ideal breeding ground for pathogenic bacteria. If mechanical friction from masturbation is added to this, the result is an inflamed system, significantly more vulnerable to infections. A urologist once encountered a clinical case of a 77-year-old patient named Carl, who presented with complaints, mistakenly suspecting prostate cancer. His symptoms included burning during urination, frequent urges, and nocturnal leakage. During the examination, it was discovered that the cause of his suffering was systematically holding urine before his usual activity, unaware that his bladder no longer functioned as efficiently as in his youth. There is also a significant psychological aspect to this problem. Some older men, perhaps due to years of habit from rushed sexual encounters, have trained themselves to ignore their body's signals or act in haste. However, neglecting bladder messages is not a sign of strength or self-control. On the contrary, it's a clear signal to slow down and work harmoniously with your body, rather than against its natural needs. If this situation sounds familiar, if after finishing the activity you suddenly realize an acute, painful need to empty your bladder, then this warning is for you. Make it a rule: always empty your bladder beforehand. This will ensure greater safety, increase comfort, and the entire process will feel much better both physically and emotionally. The second serious mistake: an excessively strong grip and rapid movements. As the body ages, one of the most common, yet unconscious, characteristics men exhibit is how their ingrained intimate habits begin to conflict with the body's natural physiological functions. A prime example of this mismatch is an overly strong grip or excessively rapid movements during masturbation. Perhaps at 30 or 40, such actions felt normal, but over time, the body changes. What once provided control and satisfaction can now become a source of long-term harm. Let's explore this further. Using a strong grip creates repetitive stress on the penile tissues, especially in the shaft and glands. Over time, this can lead to desensitization of the nerve endings responsible for perceiving pleasure. Indeed, an excess of even pleasant sensations can dull the very signals that previously caused arousal. Some men begin to notice that their response to a partner's touch diminishes. The reason isn't a loss of interest, but rather that excessive pressure has recalibrated their sensitivity. In the medical community, this phenomenon is sometimes referred to as death grip syndrome. While not an official diagnosis, urologists and sexual health specialists regularly encounter such cases. One patient, 69-year-old Henry, shared that he hadn't experienced full intimacy with his wife for almost 2 years. The reason was that he had become so accustomed to a very specific, fast, and intense style of self-gratification that his brain no longer adequately responded to normal touch or pace. There was no physical damage, but he had trained his body to respond exclusively to extreme stimuli. This is not freedom, but rather a trap. A similar situation applies to speed. Too rapid movements, especially in older age, can trigger an increase in blood pressure, cause dizziness, or even arrhythmia. If your cardiovascular system is already under strain, remember that your body is not the same as it was at 25. The body seeks pleasure, not challenges, and deep enjoyment is still accessible if you approach the process more mindfully, slowing down and making movements gentler. Masturbation is not a competition. Its goal is not to reach the finish line as quickly as possible. It's a way to connect with yourself in a healthy, safe, and satisfying manner. Therefore, it's recommended to loosen your grip, slow your pace, allow your body to express its needs, and most importantly, listen to them. Mistake 3. Ignoring prostate warning signs. Most older men don't connect self-sexual gratification with prostate health, though it would be quite reasonable to do so. The truth is, masturbation can both benefit and harm the prostate, depending on the body's internal processes. The biggest mistake is neglecting even minor warning signs of potential problems. For example, if you feel pain or pressure during or after orgasm, don't dismiss these symptoms. This isn't just an inevitable part of aging. It could be a sign of prostate inflammation, known as prostatitis, or even a more serious condition like an enlarged or irritated prostate. Some men experience acute pain behind the scrotum or deep in the pelvis, especially when sitting for long periods or during bowel movements. If these symptoms sound familiar, it means your body needs attention, not neglect. This is where the danger lies. Some men, out of habit or frustration, continue to masturbate even when experiencing pain, believing it will go away on its own. However, repetitive strain or constant pressure on an already inflamed prostate can worsen the situation. It's akin to trying to run on a sprained ankle. Instead of healing, you're slowly but surely causing more damage. One patient, 74-year-old Tom, ignored his symptoms for almost a year. He was convinced the discomfort was just part of aging and continued his usual routine. But when he finally saw a doctor, it was discovered he had chronic prostatitis that had gone untreated for too long. His recovery took significantly longer than if he had addressed the issue earlier. And it's not just about pain. If you start to notice a weaker urine stream, more frequent urination, especially at night, or a feeling of incomplete emptying, these are all signs of possible prostate swelling. Masturbating with such symptoms can cause further irritation and slow down the healing process. The conclusion is simple: the body whispers before it screams. You need to pay attention to these whispers. Adjust your habits. Rest when necessary, and don't be afraid to discuss these issues with a doctor. This is not a sign of weakness, but a demonstration of wisdom. For true strength lies not in enduring pain, but in knowing when to stop and take care of what truly matters. Mistake 4. Using harmful devices or objects. In older age, what you use during intimate self-moments matters just as much as how often you use it. Unfortunately, many older men resort to tools, objects, or devices that seem harmless at first glance but subtly cause real damage. This is one of the most underestimated dangers of masturbation in later life. Some men use lotions, oils, or gels without bothering to read the labels. Many men don't realize that certain chemical components, especially those containing alcohol, parabens, or synthetic fragrances, can irritate skin, disrupt the natural pH of intimate areas, and over time, even provoke allergic reactions. For men with thinner, aging skin, such irritation can take days or even weeks to heal. And if there's even minor damage to the skin barrier, it opens the door for infection. Then there's the problem of using inappropriate objects or tools for stimulation. Many men, experiencing a decrease in sensitivity compared to their youth, try to intensify sensations by resorting to items not designed for that part of the body, such as household objects or devices that don't meet proper safety standards. However, this carries a serious risk. What might seem inventive or satisfying in the moment can cause microscopic tears, nerve strain, or even worse, damage to blood vessels. For men suffering from prostate or circulatory problems, this is a ticking time bomb. A urologist once spoke with a 68-year-old man named Walter, who had been subtly using a homemade device for years. He never had problems until one day the injury was too severe to heal on its own. He ended up in the emergency room with a small but painful injury that took months to recover from. And the emotional consequences, embarrassment, regret, discomfort, were far heavier than he expected. Even sex toys, if not cleaned properly, can become breeding grounds for bacteria. And for men with lowered immunity or slower healing capacity, especially after 70, this is a risk not worth taking. Skin, tissues, prostate, all now need more care and gentleness than ever before. So what is the wiser path? Use body-safe products designed with aging skin in mind. Avoid anything that feels too tight, rough, or artificial. Choose natural lubricants without harsh chemicals. And if in doubt, always seek professional advice. This is not a sign of foolishness, but a demonstration of responsibility, as small decisions made in private moments can subtly protect or subtly harm your health. Mistake 5. Masturbating right before bed without allowing time for recovery. As strange as it may sound, timing truly matters, especially as you age. Masturbating immediately before bed, without giving your body time to calm down, normalize breathing, and recover, can subtly impact the quality of your night's rest and your overall energy the next day. The reason is this: after orgasm, the body enters a parasympathetic state, which in theory, should promote relaxation. However, in older individuals, hormonal shifts and nervous system responses can sometimes work in the opposite direction, leaving you overstimulated or with disrupted sleep cycles. You might mistakenly believe it helps you fall asleep, but many older men find they wake up more frequently, feel unrest, or even have vivid dreams that disrupt deeper stages of sleep. There's also the issue of prostate pressure. When a man ejaculates, especially while lying down, the prostate gland contracts and then slowly relaxes. But without movement, a walk, or normalized blood circulation, this can lead to feelings of congestion or inflammation in the pelvic area. This can cause discomfort the next morning, stiffness, a dull ache, or even difficult urination. A 73-year-old man named Dennis once shared that he couldn't understand why his lower back and pelvis always hurt when he got up. After a conversation, it turned out he regularly masturbated while lying down and immediately fell asleep afterward. As soon as he changed his routine, taking 10 to 15 minutes for gentle stretching or a walk afterward, the pain disappeared. This small change made a big difference. Older men require more recovery time. The nervous system reboots slower. Muscles and glands need more circulation. Rushing straight to bed after release doesn't give the body that opportunity. It's akin to doing an intense workout and skipping the cool down. The body pays for it the next day. Instead, if you do choose to masturbate in the evening, it's recommended to do something gentle afterward. Sit quietly, drink water, breathe deeply, and allow your body to return to a state of calm. This helps regulate hormones, soothe the nervous system, and improve sleep quality. In old age, energy becomes a precious currency. So don't spend it all right before bed, expecting to wake up full of vigor. Final thoughts. If you've read this far, thank you for your curiosity, openness, and care for your own body. This isn't a topic most people feel comfortable discussing, especially in older age. But the truth is, staying informed and making small wise choices can make a huge difference in your health and well-being. It's not just about the length of your time on Earth, but the quality of each day lived. The practice of self-gratification in later life should not be viewed as something reprehensible, shameful, or requiring concealment. It represents a natural component of human physiology. However, like many aspects of life in mature years, this intimate practice demands increased attention, a conscious approach, and greater kindness towards one's own body. Methods and habits that were effective and comfortable in your 30s or 40s may not be as suitable in your current stage of life. And that is absolutely natural. The human body undergoes changes, its nervous system functions differently, and its needs transform. Showing respect for these natural processes is not a sign of weakness, but a demonstration of profound wisdom. In light of what has been presented, the question arises: was there anything in this information that made you pause and think deeply? Perhaps it was a habit you had never questioned before, or a recommendation you now wish to put into practice.